Exactly.
Okay, so I'm going to share screen and show you a few things here. So when you log in, and I know you've already used it before,
Yeah.
you can see that we are growing a lot of the interactive learning components. Now, in our neuro, since you teach neuro primarily, I'll show you neuro first, and then later I'll show you some other little things. We're teaching neuro right now. And in the neuro class, essentially, all the skills that the students need to learn, we actually have filmed all of it. So, for example, we have a week that is balance week. The students, we've actually created the lab handouts for the professors already. So, for example, if I go to this little sidebar here, you will see that there's some complementary resources. Here, you will be able to see the teaching content, some lab handouts, and related to neuro and PNF, we have lab handouts, and we broke the app out into different little lab handouts. So for example, our students will be told that before you come to class, you need to watch these videos. And all of these tests are hyperlinked. So when you click on it, it takes them directly into PhysioU. So because we know that students learn better through multiple exposures, not just I show up to lab, you show me a technique, and then I have to remember it and know how to use it. We think today that the students should be pre-exposed before they come to class. There's a preparation, there's a methodology to learn these motor skills. Because once they're exposed to these techniques, when they come to class, I can show it on the screen again. I can talk about the clinical reasoning about why I would use it. And then they can take their device and everybody goes practice together. So that's how we run orthopedics, cardiopulmonary, neuro, because we have all the techniques technically that you need as an instructor. The other thing that I think might be useful for you is, for example, if I go, let me just go here for a second. I'm going to open a new document here. So if I go to, so imagine this is your lab handout or lecture. If I see something in the app that I want, I can basically go, so I can go to this technique. Let me go here. I'll choose balance, Romberg. I can go here, take the copy page title with link. See, it's copied now. And I can just paste it. I can paste it into my lecture. That means anytime in my lecture, I want to click on that, it will open the video in the app, because as an instructor, you have access. So as long as you're logged in and you click remember me, it will always open. So any technique in all of PhysioU, you can now copy page title with link and copy the thumbnail image. So if you go here and you paste, immediately you have the video link and the picture. We also know that the students today really like to see the videos and the visual. We purposely choose a moment in the test that represents the test so that it is not just words, but there's an image in their mind that you imprint. So part of learning, I think, now as an instructor, you can leverage all the content from PhysioU into your lectures, into your lab handouts. And we tell the students at the beginning of the program, we are going to give you lab handouts that have video links. The expectation is that before you come to class, you watch the videos once. Because when you come to class, when you've watched the video once, it will help you learn the technique so much faster. Your mind can process so many more things. So that's one of the big things that we've done. So in the Neuro app, pretty much everything from Fuglemeyer, Stream, Asia, Sensory and Motor, Light Touch, Sharp Dull, you have vestibular, all your vestibular exam, everything's been filmed for you. So that means the instructor does not have to film their own stuff, does not have to organize all that information. We can actually share this high quality video because these are all specialists who have filmed this. So we've been using these apps already for about 5 years. So anytime there's little mistakes, we've already fixed them all. You know, cranial nerve exam, everything's here. So then from Neuro, the other thing I would say that's useful to see, so you see how we've sorted these apps now. So if you go to Neuro, you'll see, okay, there's also PNF. We filmed this with an instructor from Kaiser Vallejo, the PNF program. So the students can watch all of these mini PNF philosophy. They can watch it asynchronous on their own. And then the basic principles, the techniques, and then when you come to the patterns, you can see that all the patterns have all been filmed. The instructor is telling how to do the technique and all the instructions, the functional application, what kind of movements are you trying to facilitate? What is the manual contacts? What is the commands? What is the resistance? Like this is the textbook from the PNF at Kaiser. We're sharing it to the whole world so that we can standardize the practice, right? Because I think you and I could agree that the profession is more powerful when we are somewhat standardized to clinical practice guidelines, the skill sets are relatively standard. And then of course, when the students get beyond entry level, then they can add many variations. But in entry level, it's helpful to be homogeneous, that you and I are teaching similar techniques. So the PNF app is very useful. You'll also see that under the Neuro component, we've added task analysis recently. Task analysis is built around Sheets and Hedman, movement analysis. So what we've done is we've given students the opportunity to model after an expert. So we have the videos. Side view. Simultaneous view. And then a clinical expert. We broke it up into initiation, execution, termination. And the instructor has written the analysis. So the students can see, oh, this is what the instructor sees. This is what the instructor sees. And then they can see what does it look like in a SOAP note. So then they can kind of learn. Eventually, and if you, I guess I want to show you this too. If you look at Hedman, what we've done with Hedman is we've chosen a few basic tasks like getting out of bed, toileting. This lady has a stroke. Hedman has 5 categories, not 3 categories. And so we want to show different variations of movement analysis and task analysis. So all of this has been written up by one of our professors. And then the SOAP note. And now what we've done is the students now move into practice. In practice, these are the key tasks for the Sheets task analysis. So the students can now practice. Let's watch Step Up. Let's use the worksheet here. Sorry, I know it's a little bit small, but there's a Excel spreadsheet that they can fill out as practice. And then if you look at the other version, so practice is usually how we create an interactive classroom. Because now you have all of these key movements that students can analyze and then we can discuss together. If you go into Hedman, which is a slightly different philosophy, you see that we have filmed, we went into the homes of typical patients, meaning normals. These are typical male, typical female, and then a number of different patients, COPD patient, total hip replacement patient, CVA right-sided, spinal cord injury C5. And we film them doing all the common things that they do in life so that they can do the analysis and talk about what kind of things are impaired, how should we treat it? So let me just give you a quick example. This is John doing his dressing. Actually, easier to see in the wide video here. We have close up and wide. So it shows him going through the process of dressing himself using the different adaptive equipment. And we can talk about it. How can we help him? What things do we need to treat? And you also have the ability to compare to typical. So you can now contrast. So you have the worksheet here. The students can work on the worksheet. Here's another example, eating. You can see him preparing to eat. You can look at it from different views. And then you can compare to typical. We then added in a new component called case studies. In the case studies, what we did was we took these different patients and it starts with the patient's story. This is what happened to the patient. So you create the context. And then we chose the key tasks that she does so that the students can analyze based on the story. So you can see that so many of the things we're building, we try to create easy tools to help the instructor create a context-rich environment to train the students to think. It's not just about teaching them basic tests and basic skills. Does that make sense?
Yeah, absolutely. Absolutely fantastic.
So yes.
One thing I would like to ask, that is, does it allow the evaluation of the individual student after some time?
What do you mean, the evaluation?
What is the competency level of the student over these individual tasks?
That is something that, well, let me show you how we, okay, I think one of the ways to do that is you create an assignment. You say, guys, you are going to the task analysis app and group 1 is going to do Charmaine. And in Charmaine, I want you to do slicing apple and washing clothes. And then we're going to either discuss it, you can present it to the class, or you turn it in and I will look at it. So that's how I think you can use it. And then another group will end up doing James' right total hip replacement. Right? Let's look at him after his total hip replacement, taking out his trash. You guys do the analysis, discuss it in the group, present it as a whole group. So that's one way, or you turn it in as an assignment. Please do the analysis. The other thing from the neuro perspective I would show you is, you see all the purple is all the e-learning.
Okay.
So now what we've done is we have a number of different patients and we turn them into games, but they're patient-based games. So if I show you the timed up and go game, as an instructor, you have the ability to look at the course key. The course key, I'm gonna make it bigger for you, is all of the slides of the game. So imagine at the end of balance week, we just taught them the balance test. I want them to go play the timed up and go game. I will assign it. So they will go through and they will say, oh, there's a patient. So because this is the key, you get to see the questions and the answers. The students don't get to see this. Does that make sense? So let me.
Students will not able to see this.
Students cannot see this because this feature is only enabled, meaning the key. This is the answer key. So let me show you what I mean. If I go back here, the game is here. But as an instructor, I want to see what is my students about to do so that I don't force them to do something that I don't know what's inside that game or what kind of questions they're going to look at. So what we did is we put this course key here for the instructors. They cannot see this. This is only faculty because you don't want them to see the answers. These are all the answers. The students, you assign this, right? The way I assign it is I do this, timed up and go game, copy page title with link. I'm going to put that into your syllabus. At the end of balance week, you need to do this game. Okay, so when they're in the game, here's the game here. Let me just show you what a game is like. The student will come into this game. It's a neuro sim. And it is going to ask them to recall and apply the knowledge they learned in the class that week based on a patient. So here, 65-year-old male, Asia D, spinal cord injury. He may be having a fall risk. He has some balance problems. Which test will you use to assess fall risk? So they'll choose timed up and go. Good. What is the appropriate setup? I think it's 3-meter path with a chair and a marker. Let's try that. Yep. How should a patient begin the timed up and go test? Seated with back against a chair. How should a therapist accurately conduct it? Time is started once the patient's back leaves the chair. So we'll go there. And now what we ask the students to do is use the stopwatch, play the video, and time it like you're in the clinic.
So what you're gonna do is you're gonna, when I say ready, set, go, you're gonna stand up using the walker. You're gonna come around this yellow piece, the blue piece of tape. You're gonna turn around that tape, come back to the chair and take a seat, okay? All right, so ready, set, go.
So the patient is going. When he sits back down, you hit stop. And then you move to the next slide and it'll say, how much time did it take? So it's almost like they're doing the real thing on a real patient. And then it'll ask you, okay, based on that time, please, what is the recommendation? How do you interpret that score? Well, the students can't remember. You can give them a hint. And then they say, oh, he should use assistance when ambulating in the community. Good. And then there's a little bit of movement analysis. Like when you watch him, what kind of things did you see? Decreased step length, decreased hip extension, decreased dorsiflexion probably. So I don't remember the answer, but. And then what is one appropriate intervention that can help him with that? So maybe stretch his hip flexors. Then they have the score. And when they're done, they have a learning history. So we tell the students, please download your learning report, turn it into me. I'm happy if you play it more times. I will take the highest score. The more you play, the more you're learning. And I get to see what date they did it, how much time they spent on the games to learn. And so we have, and then who did it, which game is it? So there's all of these new kind of learning mechanisms that we are creating. Soon you will see that there's like 3 or 4. So you see, these are the mini sims. Soon there will be some macro sims. The macro sims are longer. They're more involved. They tease out the clinical reasoning, much heavier clinical reasoning. That's what PhysioU is bringing to the classroom. And that is only a small part of PhysioU. We have all the basic fundamental skills, physical agents, simulations, assistive devices, transfers, bed mobility, simulations, gait analysis, range of motion MMT, simulations, surface anatomy palpation. I mean, some of these apps are just, they're amazing. You know, when you look at surface anatomy, this professor, so let's say you choose cervical spine, this professor has drawn the structures onto the patient. So in your year 1 class, where the students are doing gross anatomy and they're learning to palpate, you have a professor who will say, okay, here's the structure, SCM, and here's the professor telling you how to find it.
The sternocleidomastoid muscle creates neck flexion when operating bilaterally, and it creates contralateral rotation and ipsilateral side bending. It's very prominent on the anterior part of the neck, and you can follow its margins down to the clavicular head here, which is quite broad, and then the sternal head, which is much smaller, that attaches to the manubrium.
So every structure of the soft tissue and bony structures are all instructed by the instructor, including nerve entrapments. You know, so there is acute care, the cardiopulmonary app, lines and tubes. There is the orthopedic apps. The orthopedic apps are my apps. They're the apps that I use the most. So for example, in the orthopedic app, you have, let's say, shoulder. You have all of these different pain patterns. So you can use pain patterns to have conversations about, hey, the patient has sharp pinching pain at the acromion area. What is your hypothesis? And if you click on it, here are some hypotheses. Rotator cuff impingement, subacromial pain, or acromioclavicular joint sprain. These are the common ones. I'm not, as you know, as an instructor, the students cannot handle too much complexity. I think we do the most common patterns. We help them recognize the patterns. So let's say subacromial pain syndrome. Here you have the prevalence data. So we recently did a literature review for the prevalence. You have a video of a patient presenting with an arc of pain. Right here is his history, what they say, what kind of things you might find. And then if you go into the physical exam, we have organized all of it. So the key findings in the exam, the way I use this with my students is before I teach them all the lab techniques, I walk them through the 3 most common shoulder patterns. Right? So one pattern is frozen shoulder. One pattern is instability shoulder. The third pattern is rotator cuff injury, impingement. Those are the 3 ones that I teach. I don't teach anything else because If they can understand those three, they can help 70% of the people. So they learn, they watch a clinical reasoning video. This is what the patient looks like. This is the things that they report. And then in class, I say, so what kind of things do you think we should examine? Well, I need to examine the shoulder joint. Great, that's right. These are your lab techniques: shoulder active range of motion, passive range of motion, shoulder accessory mobility. These are all the things that we're going to learn in lab. But that's how I assess the shoulder joint. But because I think it's a shoulder impingement, I have now clustered the test. So that if you click on near test, you will see here is the likelihood ratio, sensitivity, specificity. Here is a test item cluster. So wherever the research suggests that you should look at these in a cluster, we talk about it. And then at the bottom of many of these tests, you will see that we have added the table. What is sensitivity, specificity? What is the likelihood ratio mean? And here's a nomogram, so I can draw a line to help them understand how a test helps me to improve the post-test probability. Of course, and then all the references. All of these are linked to the PubMed abstract.
Great.
Yeah. So here. So in this particular app, you'll see that it covers, here's the common, here's the common movement faults: scapular faults, humeral faults, thoracic mobility issues. Here are some associated impairments. You need to make sure you assess thoracic mobility. You need to assess upper quarter muscle length because it influences the humerus. So I hope what you can see is I'm creating a visual roadmap of clinical reasoning that usually you cannot just talk about it. They cannot handle it. But if you map it out and you teach them repetitively that we think about key findings, movement faults, associated impairments, differential diagnosis. So here's the differential diagnosis. Here, they may not learn it yet. Spine is in 1 month away. But yes, of course, we clear the cervical spine. This is how we do it. Some type of quadrant overpressure or Sperlings, maybe some PAs. By doing that, what you've done is you've created a scaffold in this patient, in the student's mind, so that when they go to lab to learn the techniques, they already have something to organize all of that data into meaningful patterns. It's very difficult to organize that later after you teach all the techniques and now they're all confused. So I use this at the beginning of shoulder week. I play these patterns out with them so that I can visually set up their mind to organize information. And eventually this, after that we talk about the exam, we have filmed all the common interventions. So here's a clinical reasoning video of the general idea behind management of this problem. Here is the common manual therapy interventions: glides, mobilization with movement, scapulothoracic mobilizations. If the soft tissue is tight, let's stretch the latissimus, soft tissue mob and stretch. If subscap is tight, soft tissue mob, stretch and retraining. And eventually, all of these are matched to the therapeutic exercise because we know that students have a hard time linking therapeutic exercise. So I'll say, hey, if you were trying to improve the mobility of the posterior capsule, you did a posterior capsule glide. Here is the matching stretch. So they can make the connection. And then we also have, of course, patient education. Every one of my students will read this so they are prepared to answer the 4 common questions. Your patients always want to know what's going on, how long will it take, what we are going to do during your care, and how you can help yourself. This is all written in layman's terms, but we use it as a way to create a baseline of knowledge so the students can now eventually add their own details, but this is the basic. And for example, if you look at a different condition, so if I go here and you look at frozen shoulder and you look at, so every one of these also has outcome measures. So whatever outcome measures are relevant, we have linked to it, so that you can show the students, when you look at a shoulder patient, this is the outcome measure that you want to use. So we're aggregating information that is scattered throughout the curriculum and throughout the web. We put it in one place so an instructor can piece together a story and help the students develop clinical pattern recognition. So we've done this. Here, I'll just show one more thing, and that is, because we are partners with JOSPT, you will see that all the clinical practice guidelines are all built into the apps. So you can see here's the grade of evidence. Here is what the guideline says about using outcome measures. Or if we look at the interventions and we say, hey, modalities. Modalities are valuable because the guideline says that sometimes clinicians may utilize shortwave diathermy, ultrasound, or electrical therapy. This is a C level of evidence. So then I'll ask the students, hey, do you remember in your class from physical agents, what is the contraindications and precautions? Half will remember, half won't remember, but the powerful part is I just go to the app. We'll look at it together. Physical agents app, ultrasound, contraindications and precautions, they're all here. Here's the questions you should ask. Here's the contraindication. And then I'll say, hey, if the patient's shoulder is frozen, it's stuck. What continuous or pulsed ultrasound? Well, here's the setup. Here's the instruction. Here's me teaching how to use it.
For the application of ultrasound, it's important to have the patient in a comfortable position.
There's a high-speed video, just 42 seconds to learn how to do the whole thing, because the students always like to just review very quickly. And then you can see at the bottom, the instructions, the settings based on the research, half-depth table, references, patient education. Why do we use it? What does it feel like? When should I avoid this type of treatment? We teach the students that when they do ice or ultrasound or heat, that they take this and they email it to the patient so that patient becomes more aware. They see extra value from the therapist. So I can just send it to myself. Me? Yeah, that's me. And you can just email that to the patient. So the power of the app is that it covers so many classes. It covers all the techniques essentially that you need to teach. The students carry this on their phone, on their iPad, on their computer. They are accessing it all the time, all the way through their practicums, their clinicals. And you as the instructor can reach back into content that you didn't teach, but we've all agreed in our program, we've all agreed that this is how we do the neuro exam. Dermatomes, myotomes, reflexes, we're all going to do it the same way. So I don't know if that helps. There's so much more. There's so much more I could show you. I don't know if there's something that you would like to see in particular.
Absolutely fantastic, Mike. I had an idea about it, but discussing with you, it's a worthwhile. It's a fruitful time to with you, that you give me a great idea about planning my class and time with my students as well. One question, because a student and the teacher needs to access this,
Yes.
you can say, Physio Una.
Yeah,
So what is the way out? I believe there is a free access of faculty or the supervisor who are being involved in the teaching,
that's right.
isn't it? Isn't
That's
it?
right.
So what about the students' access?
The students, it's the student, they pay for it like a textbook. We benchmark one textbook price. So for example, if you go to Physio U and you go to student, you can see that this app covers almost all the classes in the curriculum. And it gets cheaper if they buy more years. So 3 years is 36 months. That's less than $10 a month. That's probably like $5 a month. Except our students will use it all the way through the entire program. Almost every class, they're using it. So one way that I can help is if you ever want for me to show the entire faculty. So you're like, guys, at lunchtime, we're going to have a meeting and Mike Wong, the founder of Physio U, is going to show us how different programs are using, like an overview of the apps. I can do that for your faculty and they will all have access. So even if the students don't have the app, the faculty can already use it to help teach. Because we're all faculty, so we wanted to help faculty. We know how hard everybody's working.
Absolutely fantastic. But students need their own access to practice it at multiple times.
That's right.
Because as
Because
you
they
said,
have-
there is a mini sim you have planned to some games like tug you showed to me.
That's right.
So students need access, free access over it at free time, so they can enjoy, they can learn more and more by playing more and more games multiple times.
That's right.
So you are charging $219 for 3 years, isn't it?
That's correct.
So fine. So is there any other process between the organization?
No. For example,
If I ask you to, there is a collaboration or the coordination between the Physio U and my organization, Rifa International University.
yeah. So what happens is, for example, some schools will say, we're going to use this in all of our classes. So we're going to buy it for our students. Mike, we have 500 students. We need 500 codes for 3 years. We will issue you an invoice and then we'll send you codes to share with all your students. So that's one way. The other way is you tell students, we are all going to be using this. So please come and purchase. You can do 1 year, you can do 2 year, you can do 3 year, up to you, but 3 years is so cheap. For example, in our program, we have eliminated at least 3 textbooks. We do not have a special test textbook. We are now eliminating, we don't have a neuro textbook, we covered it here. We also don't use a GATE textbook anymore because you have the GATE app. It covers everything, right? We have it all. Real-time range of motion, real-time EMG. We have all the deviations on real patients, right? So you don't have to look on YouTube anymore. We filmed it all for you. We have all the prosthetic gait deviations, transfemoral, transtibial. So here is a guy with knee instability. So we help the students to learn all of this. So we save the students so much money now, and they're so much happier learning with this type of resource because they'd never wanted to read about how to perform a manual therapy technique. They want to watch a video. They want to see how everything's connected, the clinical reasoning, and then they can play the games to understand further. So one way is if your university says, Mike, here's my list of instructors. Can you give us all access? So if you give me a spreadsheet that has first name, last name, and email in one row, but different cells. I can give access to your whole faculty, and then you guys can just play with it.
First name, middle name, and last name.
Or yeah, you know, it's like first name, last name, Michael Wong, and then my email.
Okay, email address.
Yeah, email address. So they're all different cells in the same row.
Okay, fine.
And then if you, so first I can get them access. The second thing I would say that's really useful for your faculty is if they go here under the website and they go to physical therapy faculty, they will see that I have created, so whichever classes you teach, if you click on that, you will see a mini app tutorial. Every app has me talking you through the key parts of it and how to use it in your class. So now all of your faculty can just say, I teach neuro. Great. So go back to the physical therapy faculty. Go back to neuro here. And they can learn about all the neuro apps. They just watch, you know, like a 5-minute mini lecture, 4 minutes. Let's take a moment to explore the neuromuscular rehabilitation app, part of the neuro rehabilitation series. And so it'll teach them. So that's probably what I would do is once we unlock access to all your faculty, we will send them a welcome email and it will invite them to come explore some of these mini tutorials.
That's nice. That's nice.
Yeah. And then of
So
course, on those Friday webinars, we have them all recorded. So even though you cannot come, if you go to educator, faculty resources, here are all the webinars that I've done. Basically, it's like a 1-hour deep dive on neuro rehab and PNF, neuro exam and simulations, just like what I did for you. They're all here. So there's a lot of different ways for your faculty to learn about how to teach with this new technology.
Can you, if we request or ask you to arrange a specialized session for all of our instructors or the faculty members, will it be possible?
Absolutely. I do that all the time for the universities. I usually need about an hour to do an overview of the key categories of apps. And then I show them, here's how you add videos to your lectures. Here's how you use simulations. And then I can just take questions from different people.
I do have a specialized faculty which has subdivided into the orthopedics, neurological physical therapy, cardiopulmonary, sports, and women health.
Yes.
So I might request you on the basis of the specialty. Once in one meeting we discuss the orthopedic scope. In another meeting we will discuss the another specialty including the cardiopulmonary or etc.
Perfect.
I found I was observing there is a little or no material regarding the women health physical therapy, isn't it? Or
we haven't gotten there yet. We're in the discussion phase.
Okay.
It's a little bit tricky, of course, to film that kind of stuff.
Yeah.
And we're talking about it on in the United States. We are trying to sort out ourselves what is entry level. And once we establish what is entry level, then we'll decide, what's the right way to create an app to support that education. But for now, you know, one of the newest apps we're going to release, we have a neuroanatomy app that's coming. You're going to love it. It's amazing. In fact, let me just, so I don't want to take more of your time, but you'll get an email that says like by June 1, the neuroanatomy app will be out. It's a game changer. It's amazing.
Great. So you are talking about the entry level regarding the women health?
Yes. Like we're trying to figure out in the United States, what is the basic skill sets that entry level should teach? That kind of thing. right? Because it's so new and it's a little bit wild in the post-professional continuing education world, and it's just a little bit sensitive, so it's hard to,
yeah,
yeah.
absolutely. And what about the sports physical therapy?
Sports physical therapy is built into the orthopedic stuff. So a
Right.
lot of the orthopedic injuries is the sports injuries.
Oh, yes.
You know, so that's built into the orthopedic app. Yeah.
Great.
Because what I didn't show you is in the orthopedic app, let's say you have knee problems. It covers all the common conditions: ACL sprain, hamstring sprain, IT band syndrome, knee OA, LCL, MCL, meniscal tear, patellar tendonitis. Like, it's all there. All the patterns, all the faulty movements, all the testing, all the strengthening, it's all linked.
Great.
Yeah.
Great. Fantastic. I'm really impressed, and I'm going to use it in a different way. And this is, I believe, make a great impact in my teaching.
Wonderful. I'm so excited to hear that. I was so glad that we could find a time to connect, because today PhysioU is very different than what it was in the past.
Exactly.
It is so much more powerful. And the things that, for example, last night, the product team met. We were putting together an oncology rehab app because nobody knows what to do after someone has breast cancer.
Yeah,
We
absolutely.
can map it all out. We can help the instructors teach it. So there's, you know, we have a bunch of wound care sims. We have some cardiopulmonary simulations that we're building. There's just a lot of powerful stuff. I won't share it all with you today, but there will be more conversations. I'm so excited to connect with you. And as I think the first step is to help your faculty learn about PhysioU and use one small thing, but use it a lot. And when they begin to see how they can use it, then there'll be new things that I can show them or that they will learn about. Because sometimes it's overwhelming. There's just too much stuff. But there is many things that we're working on that are very powerful. Like, we have an interprofessional experience. We're running it among multiple universities right now. Created a simulation that is a neuro patient, and you get to watch a doctor, a nurse, a PT, a OT, and a speech. They each do a short evaluation and a short treatment. And we allow the students to see what the other professionals do. And then at lunchtime, we bring all of these speech, OT, and PT students together, and they have a discussion. And they learn about each other. All of that is part of the things that eventually you guys will be able to use. Right now, we're piloting it. We're getting feedback. We're presenting it at the conference. And then we release it for PhysioU family.
Great. This is another way of learning.
Yeah.
That you created an interdisciplinary approach.
Yeah.
In learning as well.
Yes.
That's awesome.
So yeah, I'm happy to connect again anytime. Do you have?
Yeah, sure. I will be in touch with you, and probably I will be disturbing you in every some sort of regularly time frame.
Perfect.
And one last thing.
Sure.
What is the way out? To start the collaboration between the two organizations like PhysioU and my university, if there is?
I think the easiest way, when you say collaboration, does that mean how to get access for our students?
Yeah, access for students, for faculty, and you can say a full-fledged in the financial contribution, subsidized, you can say.
Yeah, so I think
we will be able to provide the intellectual input as well, probably.
Yeah, I love that.
Because there are certain difficulties in the teaching. that might you won't have at your side.
Yes.
But being a Pakistani, being a third world country, being a different environment, different socioeconomic limitations, social gatherings, we do have different scenarios.
Absolutely.
So one of the faculty member might come up with a great problem, and that will be unique for you. And
Yeah.
this is how we can work together to improve
Absolutely.
the things for all the community of the physical therapists globally, rather to work for a specialized population.
So just so you know, I grew up in Singapore. I have a very global view of what I'm trying to do with this project. And we also, I guess, when it comes to potential collaboration, my job is to connect with guys like you and your faculty to hear what you need, to hear what are some of the cultural, social things that may be different that we could consider changing or modifying. New ideas of how some things are different. For example, sometimes cardiopulmonary physical therapy is different in the other countries than in the United States. In the United States, we have respiratory therapists. We have, they don't do a lot of the pulmonary, because we have the respiratory therapist. I don't know what the differences are, but that's just part of the conversation as we begin to develop the relationship. You just reach out to me with ideas, and then we get to create things. We talk about things. In terms of if you want to figure out access for your students, and also, for example, if you said, Mike, we have 500 students, but we cannot afford the same amount, we can figure something out. We intend to be able to do that because we know the financial resources are tight in many countries. The other thing I will say, though, is that all of us in education are thinking about what are the tools that we are asking our students to pay for. So we are carefully eliminating certain textbooks that just aren't that great, and we don't use them, and we pay for PhysioU because we need the money to film all these things, to build all these things.
Absolutely, I got it.
If I'm very curious, actually, from your perspective, is that price point 3 years? So if we go back to this price point here, is this price
$219?
Is this price point unattainable for your students or for the university for 3 years?
I can't say yes or no right now, because I'm not in the position to say to take the decision over it. I need to discuss it with the higher authorities, immediate bosses of mine, and discuss it with them. And because the university is being charged to every student of their in terms of the semester tuition fee, and which has certain you can say encompass the things. So I'm not able to say that this is the fee which is being bared by the university or the student in the tuition fee, in their tuition fee. If what I believe, if I advise all of my students to enroll or register at PhysioU by paying such amounts, fulfilling the requirements of the PhysioU portal, that might possible there is a low compliance from the students, because every student has different financial constraints.
That's right.
So that might affect. So probably I am talking about some officially the things that university will engage PhysioU, and university offer the access of PhysioU to each of the student that will increase the compliance.
That's the right way to go. Many of the universities in the United States, they will purchase this 3-year and they just build it in as a lab fee. So meaning the students, either the student loan pays for it, it's just part of the tuition. Because the power of the app is when the instructors are using the same resources that every student has. Now, I will say that we are open if you guys come as a group, you're like, we have 500 students, we really want to use this, we have financial constraints, can we work out a deal together? I think this is the beginning of that type of conversation. We have not had many of those conversations yet because we have been testing all of this stuff in the United States market, which is it's a very challenging market to break into. But we are now in probably over 60% of the programs in the United States. So we have the validation, and we purposely chose this price point because it's less than $10 a month. People buy Starbucks for $10 a day. So we think that the price point is reasonable. And yet when we talk about our colleagues in other countries, we're absolutely willing to work with you to figure out a way to make it work, because this is not meant to be an exclusive resource for only the first world countries or whatever, the developed nations.
Absolutely, absolutely. This is the point of concern. So one thing, the PhysioU is in the process of the validation.
No,
Or are you working over it, or do you want to work in the near future?
on what validation?
Yeah,
Pretty
the
much.
experiences of these students, what is the difference between the convention and the learning over the PhysioU?
Yeah, we have some data. We have presented some data about it. The students, I will present that data to your faculty. The students have talked about how they are less anxious in lab because they have the videos that they don't have to worry about filming. They watch it multiple times. They talk about how it helps with higher level learning, synthesis, preparation for the clinic, because they can see all the connections. So we've gathered that survey data and we presented it at our educational leadership conference. And I can share that with you guys when we meet. It's a
absolutely. That gives me a great background to convince my authorities.
Yes. Yep.
And I would love if you allow us, so we can run the same program at my side as well later on.
Yes, absolutely. It's really just right now, it's really just a simple survey that asks the students what is their experience and what do they feel when they use these tools in the class.
Great. Great meeting, Mike.
Yes, great meeting.
I would finally request you to, if possible, if you could provide us the invoice for 500 students. So what it could be.
Okay. Yes.
What it could be at, so we can discuss, so I can discuss with my authorities and come up with you to discuss
some kind of option that will make it work.
Yeah, absolutely.
You want
I need a background.
The three year for 500 students?
Yeah, absolutely. Rough estimation is 500 students.
And you want the 3 year instead of the 1 year? Okay.
So what you suggest, yearly or the 3 years package?
No question is the 3 year package. No question. Because the power, remember, is that they're using the app from the beginning of the program all the way through their clinicals. It's not a textbook
absolutely.
that they read in one semester and put it away.
Yeah, because we are running a DPT program for 5 years, in which the clinical practicum starts from the third year, third, fourth, and the final year, fifth year, leads to the house officership.
If that's the case, we should build that into the conversation and figure out how to get 5 years for your students. And we'll work out one price, because many of our students will say, I am so thankful that I had this apps with me when I'm out in the clinic. I have all my tests.
So does it include the anatomy and the physiological parameters, as you said that there is a project of neuroanatomy which is being you can say launched from January or June?
So for neuroanatomy, we have, let me just see for a second here. I don't think, this is just a sample, okay? But in this sample, no, actually, I can't show you because these guys are working on it. It's not ready
Okay.
yet. But we only have neuroanatomy. We are not doing anatomy because there's so many other big companies that do it. That we're not interested in that. We're doing
What
Yeah.
about the therapeutics? What about the range of motion exercises learning, passive range of motion exercises learning, stretching exercises, or the resistance training,
oh,
which we usually cover in the therapeutics?
yeah.
Or
What we are working on filming an app that covers all the basic therapeutic exercises. It's going to take us about a year because we have to organize it carefully.
okay,
Yeah. But I mean,
okay.
you've got pharmacology, you've got splinting, you've got range of motion MMT,
Electrical agents,
electrical
electrotherapy, physical
agents.
agents.
We recently just released, oh, you even have developmental milestones. We filmed the baby for the first 12 months of his life, the same baby.
Ah, that's great.
So you
you
can
give
just
me-
see how he changes.
By seeing this, you give me a great opportunity. Since today, I have been utilizing the CDA website,
Yeah,
CDC website.
that's right. Now you can say, hey, this is what the baby looks like at 2 months. And then this is what the baby looks like at 5 months. And it tells you what they see, what is the atypical development. It's all there.
Great, great, great,
Yeah.
great.
It's amazing, right? It's,
Absolutely, absolutely. It's
I'm always
wonderful.
so excited to share this because I really believe that we can help the educator do their job better by providing the basic tools that you don't have to create.
Great, great, wonderful, wonderful, wonderful work. Appreciated, appreciated, more than appreciated, Mike.
Yes, I will reach out to you. I will put you in touch with Tina, who will send you an invoice, just an estimate. And then we can go from there. I'm looking forward to working closely with you.
Absolutely, absolutely. As I received the invoice, so I might go for a discussion with my authorities and come back to you with a positive response, hopefully,
Wonderful.
and trying to convince them to get the access for all of the students and the instructors which are being involved in the clinical practicum.
Yes. Great.
And everyone will get the benefit out of it.
Yes. Wonderful.
This makes a great difference for in teaching and learning of my student as well.
Wonderful.
And I am very, very glad to have you, and appreciated your work, appreciated your time, appreciated your team, appreciated your teamwork. In fact, that how you are giving me the space to discuss such things and receiving the inputs to improve the gadget.
Wonderful. Yes. And I will send this video to you.
Absolutely.
So that you can always look
I'll
at
be
it
looking
again.
forward.
And then anytime you need me to meet up with your faculty, please feel free to reach out.
Absolutely, absolutely, absolutely. I'll update you.
Okay. Take care,
Keep
my
in
friend.
touch. Same to you. Have a
Okay.
blessed weekend.
Yes.
Enjoy
take
your
care.
weekend.
Bye-bye.
Bye-bye.